The today's topic covers the first trimester ultrasound and its importance. The pregnancy test is positive due to beta subunit of HCG. There is alpha and beta subunits. So alpha subunit cross reacts with LH. Hence beta subunit is taken as used for detection of pregnancy. Now, what are the uses of first trimester pregnancy? First trimester pregnancy to confirm the pregnancy, dating, and also any complications which are there during the first trimester. Now, the gestation sac is visible ultrasound on TVS, transvaginal sonography, when the HCG concentration is around 1500 international units, and transabdominal when the HCG is 2500 units. This is called as discriminatory level. Now there are some events which occur in the first trimester pregnancy scanning which appear. So the first thing to appear is gestation sac when the HCG concentration is 2500 units. Now the events are when the gestation sac, there is also a double decidual sign which confirms that it is a pregnancy. Either anechoic to rings, it is called as double decidual sign. Now the gestation, when the gestation sac is 8 mm, the yolk sac becomes visible. So yolk sac is from the endoderm, and the function is nutritive in the first trimester, and also it supplies germ cells future. It appears around 5th week and disappears by 12th week. Now there are events when the gestation sac is 8 mm, yolk sac is seen, and when the gestation sac is 16 mm, fetal pole should be seen. Then when the gestation sac is 25 mm, fetal heartbeats are to be visualized. And also when the crown lump length is 7 mm, fetal heartbeats are to be visualized. So if the fetal heartbeats are not visualized when the crown lump length is 7 mm, it is a non-viable pregnancy. So here the algorithm is, if there is a discrepancy, the gestation sac diameter is continued. If it is up to 25 mm gestation sac, no fetal pole is seen, then it is a non-viable pregnancy. And if the crown rump length is more than 7 mm, and if there is no cardiac activity, then it is a non-viable pregnancy. You can calculate the period of pregnancy by knowing the crown rump length. So you have crown rump length is in millimeters plus 6.5 gives the weeks of gestation. Suppose the crown rump length is 6.5 mm, the gestation age is 13 weeks. Now there is a condition called as pregnancy of unknown location. See, so here the thing is, when HCG is more than 2500 and gestation sac is not seen in the uterus, so or by this anywhere, it is called as pregnancy of unknown location. So here the thing is, you divide the algorithm whether it is pain without associated with pain or painless. Suppose if it is associated with pain, it goes in favor of ectopic, and further management is to be done. Straight away laparoscopy is to be done. If it is painless, so what is the algorithm, how to follow? So pregnancy unknown location is when the HCG concentration more than 2500 units and gestation sac is not seen in the uterus or anyway in the abdomen. So here the algorithm is there. So the algorithm depends upon, there is at least a doubling time of HCG. So here they will take at least 66% increase of HCG every 48 hours. Suppose there is increase in HCG by 66% 48 hours, you go on scanning every 40, and you go on measuring HCG every 48 hours. One or the other day scanning, it will reveal intrauterine pregnancy. Suppose if the HCG increase is erratic, 20%, 30%, then go on scanning after many weeks. After, if it does not reveal intrauterine pregnancy, erratic increase 20%, 30%, and even after 4 to 5 weeks of scanning, it does not show any intrauterine pregnancy, then this is called as persistent pregnancy of unknown location. So here they will give methotrexate 2 to 3 doses. So then if it reduces, HCG reduces every 48 hours, go on scanning, and one or the other day the HCG, if it less than 5 units, so you can should tell that there is no pregnancy. Pregnancy is not there. It is it can be left behind.